World Health Organization has declared the outbreak of the Mpox viral disease.
The situation constitutes a public health emergency of international concern.
So today we are going to delve into the Mpox viral disease, what it is about. We're going to look at the symptoms, some ways of transmission, and also preventive measures against the spread of Mpox viral disease. My name is Adjoa Dumansa and this is Health Talk with Fiifi. Kindly like, comment, share on this video. Also follow us on all socials at Health Talk with Fiifi. Now let's get into today's video. Monkeypox virus is a zoonotic viral disease caused by the monkeypox virus. So when we say a disease is zoonotic, it means that it can be transferred from animals to humans. So this particular disease happens or occurs in animals, but can be transferred from animals to humans, making Mpox virus a zoonotic disease or zoonotic viral disease.
This is not just an African issue. Mpox is a global threat, and it is in this moment of vulnerability that we must find our greatest strength.
Now, this monkeypox virus was identified in 1958 when outbreaks occurred in monkeys that were being kept for research. So that gave the name monkeypox. So this outbreak occurred firstly in monkeys that were kept for research in 1958, and it brought up the name monkeypox. The first human case was recorded in 1970 in the Democratic Republic of Congo, DRC, during a period of intensified effort to eliminate smallpox.
The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
So that is a little about monkeypox. Now let's delve into the symptoms, transmission, and preventive measures, as well as treatment of monkeypox virus. Monkeypox is primarily a disease of animals, particularly rodents. It can be transmitted to humans through direct contact with the blood, bodily fluids, or skin, that is the mucosal lesions of infected animals. Human-to-human transmission is less common, but can occur through close contact with respiratory secretions, skin lesions of an infected person. The virus can enter body through broken skin or recently contaminated objects, respiratory tract, or the mucous membranes, eyes, nose, or mouth. So these are ways monkeypox virus can be transmitted, and these are the transmission routes of monkeypox virus. Now let's look at some symptoms of monkeypox virus. Before that, let's look at the incubation period, that is from the time of the infection to the very first symptoms for monkeypox, which usually is from 6 to 13 days, but can also ranges from 5 to 21 days. So the infection period can be divided into two. First one, we have the incubation period, which lasts 0 to 5 days and mostly characterized by fever, intense headache, lymphadenopathy, that is the swelling of the lymph nodes, back pain, myalgia, and intense asthenia, that is lack of energy. We have the eruption period, which also lasts within 1 to 3 days after the appearance of fever. So right after the appearance of fever, a rash develops, often beginning or starting from the face and then spreading to the other part of the body. The rash will now progress through different stages, 5 different stages. One is the macles, a flat lesions, papules, raised lesions, vesicles, fluid-filled lesions. We have pustules, pus-filled lesions, and the last one is crust. That is before eventually falling off the last stage, crust. Now let's look at how severe and mortality rate of monkeypox. So monkeypox is generally self-limiting, with symptoms lasting to 2 to 4 weeks. However, severe cases can occur, particularly in children and individuals with underlying immune deficiencies or individuals with immunocompromise, who are immunocompromised, individuals with low immune function or system. The fatality rate varies but has been reported to be between 1 to 10% in the general population and higher among young children. So this is how severe monkeypox virus is. Diagnosis of monkeypox virus. So monkeypox can be diagnosed using several laboratory methods. One is PCR, polymerase chain reaction. This is the most reliable and commonly used diagnostic test. It can detect the viral DNA in skin lesion samples, such as a vesicle fluid or crust, which is considered the best sample type for monkeypox virus. There is also serology, antibody detection, which can be very useful for retrospective diagnosis or in cases where PCR is not available. There is also virus isolation. This involves growing the virus in culture, though it is less commonly used due to its complexity and the need for high biosafety facilities. But it's also one of the methods of diagnosing monkeypox virus in the clinical settings. Now, let's consider some treatment for monkeypox virus. So there is no specific treatment for monkeypox virus, but care is generally supportive. However, the antiviral drug, which was initially developed for smallpox, has been approved in some countries for treating monkeypox under certain conditions. Vaccinia immunoglobulin (VIG) can be considered for severe cases, particularly in immunocompromised individuals. So these are some of the treatment options for monkeypox virus. Now, some preventive strategies that has been put in place against monkeypox virus is 1. Vaccination. So smallpox vaccination has been shown to provide cross protection against monkeypox. So in 2019, a specific monkeypox vaccine, MVABN, was approved for use in some countries. Vaccination is recommended for individuals at high risk, such as healthcare workers and those exposed to confirmed cases. 2. Public health measures. Early detection, isolation of cases, contact tracing, and the use of personal protective equipment are very essential to control outbreaks. Reducing animal to human transmission, that is point 3, particularly in endemic regions, and proper handling and cooking of meat can also reduce the risk of having or contacting monkeypox virus. Now, what are the response of public health as a result of monkeypox, or so far as monkeypox is concerned?
Mpox has been reported in the Democratic Republic of the Congo for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 14,000 cases and 524 deaths. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Now, it is our responsibility to put in place some measures against the spread and the future outbreak of the monkeypox virus as individuals. This is Health Talk with Fiifi. My name is Adjoa Duma Ansa, and see you same time next week. Kindly subscribe, like, and share this video. Also follow us on all socials at Health Talk with Fiifi.